Good afternoon, everyone, and welcome to this side event on protecting civilians in active conflict. This event is organized by the GICHD on behalf of the Explosive Ordnance Risk Education Advisory Group, or the EORE-AG. The EORE-AG is a coalition of over 18 organizations, including National Mine Action Authorities. It was established in 2019, and since then, the AG has catalyzed collective efforts to improve the integration, efficiency, and relevance of EORE within mine action and other sectors. My name is Lubna Allam, and I'm the EORE Program Officer at GICHD, and I'm also the EORE Advisory Group Secretariat, and I'll be facilitating today's discussion. On the International Day for Mine Awareness and Assistance in Mine Action this year, the UN Secretary General reminded us that over 100 million people globally are at risk from landmines, explosive remnants of war, and IEDs. He emphasized that mine action is not just a technical activity. It's a pathway to rebuilding communities. Today's session builds on that imperative. While the first plenary session of this year's NDM discussed operational approaches to urban contamination, our event will focus on Conflict Preparedness and Protection, or CPP. CPP can complement EORE interventions in active conflict in contexts where the safety and security of civilians is most needed but hardest to deliver. So CPP, as we're going to hear today, is a needs-driven, interactive safety and security approach that empowers civilians with practical knowledge and tools before, during, and after emergencies. It addresses broader threats beyond explosive ordnance. We are currently witnessing an alarming increase in explosive weapons and civilian casualties. Yet, this is happening at a time when resources are dwindling and international frameworks are destabilizing. Now is not the time to deprioritize approaches that contribute to the safety and security of civilians in active conflict. Quite the opposite. We will see from our panelists that CPP has been increasingly used alongside EORE interventions across humanitarian responses, from Gaza to Lebanon, from Ukraine to Southeast Asia. We have also seen the rise in CPP efforts with examples already shared in Finland, Norway, Sweden, and now under preparation in France. During today's event, we'll hear from 7 panelists. Some of them are with us here in person and others joining us online. They will speak about the safety and security of civilians, and more specifically, the implementation of CPP. We have here in the room with us Hannah Jordan from NORCAP on behalf of the Consortium for Civilian Safety and Security, Colin Bend, Global Special Advisor CPP at MPA and co-chair of the EORE AG Emergency Risk Education Task Team, Marie Grenet, Armed Violence Reduction Specialist, Southeast Asia at HI, and chair of the CPP subtask team, Hugues Lorange, Mine Action and Explosive Weapons Global Lead at UNICEF and EORE AG co-chair. And joining us online, Mohammed Saleh, EORE Project Manager HI Palestine, Lieutenant Colonel Ali Makki, Head of Media and EORE Section at the Lebanon Mine Action Center. Following our discussion, we're going to have the Q&A session, so please hold your questions until then. So now, with our first segment, we're going to set the stage, set the scene with insights on where CPP fits in broader space of civilian safety and security. So Hannah, I'm going to start with you with your work for NORCAP, and also here you're on behalf of the Consortium of Civilian and Safety and Security. So can you tell us a little bit about the consortium's work, the approach to civilian safety and security, and how CPP fits into the broader efforts, especially in the face of the rising insecurity and shrinking resources?
Sure, and thank you very much. And thank you very much for inviting me here today to speak on behalf of the consortia. My name is Hannah Jordan, and I work with NORCAP. I'm actually our protection thematic manager. And which one? Sorry. Too many microphones. And NORCAP is a part of a consortia that is looking at how to enhance interventions that aim to increase the safety and security of affected populations in armed conflict and other situations of violence. But I want to start out by maybe asking a question that you may be asking yourself of why is someone who has the job of protection having this conversation? And when we started this discussion with the two partners of the consortia, which is NOHA, the Network on Humanitarian Action, and ODI, we were really trying to unpack what are the problems and challenges that we saw in the protection sector and in the protection space. And one of those problems that we saw as the biggest gaps is really how can we be better at supporting the safety and security of affected populations. So as a very practical example, if we are working in a community and we know that there's a lot of harassment at a checkpoint, typically, and of course there are going to be ad hoc examples, but typically what do we do as protection actors to address that problem? And we found that, again, typically, we don't actually do a lot to address the problem. We might monitor it, we might report it to someone, but not a lot of organizations and not a lot of entities would say, okay, we have a problem of violence at a checkpoint. What are we going to do to address it? And so this consortia was born, it was established in May of last year to really look at that issue and to really look at how can the sector and how can the aid space be better at supporting the safety and security of affected populations, and what does that actually mean in practice? What does that mean? How can we operationalize that? And I'm going to pose a question to you, is as part of this humanitarian reset that we're in right now, how do we really keep the protection of civilians in active conflict on the agenda? How do we operationalize that? What does that mean? And how do we clarify that in practice? So one of the things that the consortia did is we spent a lot of time, number one, on identifying what our name was. So because the topic and the term protection is internalized and defined differently by a lot of different people, we really wanted to go, what is the outcome? So what are we trying to achieve here? And that is civilian safety and security, which is where our name came from. But then we really wanted to start to unpack and identify what are these modes of action? So what are we actually talking about when we have this outcome? And we came up with this framework that is absolutely not confirmed. It's just a draft framework, but I wanted to present it today as an example of some of the work that we're trying to do. And I really want to draw your attention to the categories of interventions or these modes of action. So what we really tried to do is unpack. We looked at a lot of different activities and work in the humanitarian space, in the human rights space, in the peace building space, to say, what are we doing concretely? And we realized that there are about 6 areas or 6 modes of action or categories of interventions that we felt that could describe this type of work. So from left to right, humanitarian diplomacy and advocacy, dialogue, influencing, and negotiation, conflict mediation and resolution. And we really looked at the objective of those really is to responsibly engage with different duty bearers and parties to an armed conflict. And then also protection by presence and accompaniment, information as aid, and a very big category which does not have a name, but we're tentatively calling for the sake of a better thing to call it, anticipatory action for conflict, or potentially CPP. And what we're trying to do is what actually is involved in these modes of action, and I really want to focus on the last one, which is CPP, is we looked across the globe and different activities that aimed from civilian evacuations to early warning, to contingency planning, to different types of work to really support and work with communities on this preparedness aspect of different situations of conflict and violence. And we felt like that kind of could go into one mode of action. But we also realized that a lot of this work isn't necessarily structured or standardized. It's also in a lot of different spaces in both the humanitarian and peace building sectors. So one thing that you probably will see that is not included in this framework is we're not necessarily defining what type of violence or what type of conflict. So we realize that a lot of these modes of action could be done for a lot of different sub-purposes. So it could be done to address a challenge of violence at a checkpoint, or they could be done to negotiate to conflicts or to challenges between 2 communities before they erupted into violence. Or mode of action could potentially, with protection by presence and accompaniment, if maybe there's a vulnerable woman that needs to get somewhere in a community that's affected by conflict, what can we do to help protect her better? So it specifically is not tailored towards a specific group or a different type of violence, because we are really trying to unpack and identify what those modes of or characteristics are. So challenges. There's a lot of challenges to this type of work, and I want to finish my couple of minutes to really look at some of those challenges. Number one, in this work that we've done, we've realized that the lack of mandate is a really big challenge. Where does this actually sit? What sector does this sit in? What kind of organization has the mandate to do this type of work? And is this challenge of mandate actually leading to a potential gap in some leadership over this type of work and how to move this type of work forward? The second thing is the silos, is we realize that a lot of these interventions and actions could be done in the different silos that we work in, and multiple, also not only within the silos, but in the different sectors. And how can we break those down? And are these sectors and silos actually creating barriers for us for collective learning and collective growth? And then also, how do we push this work forward and keep it on the agenda when we are so siloed within the specific areas that we work in? One of the challenges we also found is that because there's this lack of systems around this type of work, we also noticed that funding to these types of interventions are really challenges. When you talk to donors, where do you fund this? What type of portfolio or envelope do you fund this in? Is it in a peace building envelope? Is it in a nexus envelope? Is it talking about humanitarian? Is it in the protection envelope? Is it in the GBV envelope? Is it in the mine action envelope? So how do we fund this type of work and these types of interventions so that there can be more advocacy towards them, more policy developed, and so that there can be a space for learning and acceleration? And that really means how do we identify also collective challenges and then collective solutions? And one of the concerns that we've noticed recently is that because some of these challenges around funding and around mandates, around leadership, organizations who are doing this type of work are actually having to hide that work within other funding portfolios. And that somewhat dilutes some of that work that happens. And so that's maybe, I'm gonna stop a minute early and hand it over and really pose that question to the group to say, what can we do collectively to push this type of work forward, to push these interventions forward, to break down those silos, so organizations who are implementing and communities who are doing this work on their own accord are able to have access to funding, are able to communicate it, are able to organize around it, and accelerate and advance that type of work. Thank you.
Perfect. Thank you very much, Hannah. And as you gave us the why to the question, I think this could bring us to Colin. You could bring us to the how. So in your work with the MPA and in the Emergency Risk Education Task Team, you've been instrumental in guiding the sector's practical integration of CPP. So can you first let us know why the Emergency Risk Education Task Team was created, what's its role, and more specifically, its current priorities when it comes to supporting different actors in scaling up CPP?
Yeah, absolutely. Good afternoon, everyone. Great to be here as part of this panel, and thanks to GICHD for organizing it and inviting me. I'm one of the co-chairs for the Emergency Risk Education Task Team, which was established a year ago under the EORE advisory group, really in response to the growing need to deliver risk education in active crises and emergencies around the globe. We've seen in the last few years conflicts on a massive scale in Ukraine, in Gaza, Lebanon, Sudan, Myanmar, and in these contexts we're having to respond and conduct risk education, firstly in contexts where explosive weapons in populated areas are being used used widespread across the context, and also, leaving tremendous amounts of ERW contamination. The difference between some contexts and an emergency context when it comes to risk education is that, especially in these contexts that I just mentioned, operators are facing many inherent challenges. So not only are they facing a wide range of conflict-related risks from explosive weapons and other conflict-related risks, but access is inherently restricted. Mass displacement and return poses a massive problem for how we do risk education, and there's any number of additional barriers and obstacles that we have for delivering risk education which just don't exist in non-emergency scenarios. Additionally, we're often in emergency scenarios far too slow to react. When an emergency breaks out, we haven't often, as organizations, been able to do the footwork ahead of time in order to respond in a timely manner. And by doing so, we are missing the best and most highly impactful time to intervene in an emergency. And this is when we do respond in a humanitarian emergency, often we're doing so in a situation where risk education, safety messages and materials have not yet been developed. There are no standards, maybe. There's a lack of tools, technical guidance, and often lack of coordination. So this ends up reducing the speed at which we can introduce risk education and the effectiveness of our collective risk education activities. So the Emergency Risk Education Task Team was set up to kind of tackle some of these issues, to get rid of some of those barriers and respond to some of the needs that we as a sector have understood need to be addressed in order to effectively respond during emergencies. Because of the complex nature of these emergencies, we've seen a growing use of explosive weapons in populated areas, and therefore Conflict Preparedness and Protection, or CPP, as a direct, concrete activity to address these needs was tabled within the group as something key for us to address, as well as incendiary weapons. We wanted to address and look at the risks posed by incendiary weapons, especially given their use in the Gaza Strip, and Lebanon, and other contexts. So the Emergency Risk Education Task Team is currently made up of 23 sitting members from 15 different organizations, and we've also brought in expertise from a range of different sectors. So from humanitarian mine action, risk education, CPP, protection more broadly, trauma care, incendiary weapons experts, and disaster risk reduction. And these task team members are organized into 3 separate sub-task teams, each focused on a specific priority that we want to tackle as part of our mandate. The first is incendiary weapons, so looking at the risk education messages that can and should be part of addressing incendiary weapons and everything from risk mitigation to treatment, conflict preparedness and protection, and EORE in natural disaster hazard settings. So each task team is focused on mapping initiatives. We've had them establish libraries of known materials, research documents, and we're going to make these available to all members. We have regular meetings, sharing knowledge, creating content that helps us share information, having peer-to-peer exchanges and communication, and we invite experts from different fields connected to CPP and incendiary weapons and natural hazards to give presentations at our meetings. And tool development. Very importantly, we have that issue of kind of missing technical resources available to our members. So especially CPP, this is really important. This is a kind of a new area of intervention for many of our partners, and we have this subtask team focused on CPP led by Marie, and she'll tell you a bit more about what they're doing in order to advance the efforts there. Thanks.
Perfect. Thank you very much, Colin. And from what you've mentioned, we know that now the CPP subtask team is focused on several deliverables, and among which are the integration of helping the sector in the integration of CPP. So, Marie, we want to dive with you into how we can enhance the quality of CPP through coordination among different organizations and also across different contexts. So tell us a bit more about the role of the CPP subtask team, realities and challenges that you've encountered in harmonizing messages across different humanitarian contexts. So over to you.
Thank you, Lubna, and thank you to the GICHD for organizing this event and for the invitation. And thank you for my co-panelists also displaying and showcasing all the work that is being done in terms of CPP. So Hannah was mentioning earlier about the fact that we are lacking international frameworks or standards. So about like how can we strengthen CPP? How do we develop CPP on content and messaging? What's the limits? What should we include? What should we not be including into the messaging that we are delivering to populations that are under the threat during conflict? So, and a lot of this is being done, it's a lot of learning by doing. We are doing this through coordination among actors, either in specific context or through the CPP subtask team. So I will not go over again the main objectives of the subtask team because this is something that Colin already covered, but I can already explain a little bit to you what the work that is ongoing has been done by the CPP subtask team. So this CPP subtask team has been created more or less in the same time as the Emergency Risk Education task team, and already we've been doing a lot of work or planning to be doing more work. So we've already been able to map most of the main CPP initiatives. We know for a fact that there might be more that we do not know of, or maybe because, as Anna was mentioning, they might be under a different framework or under a different name. But we mapped most of them, and we mapped them in at least 10 countries, including Ukraine, Gaza, Lebanon, Mozambique, Myanmar, Sudan, Syria, and Yemen. We've developed a shared library of CPP materials and messaging with contextual materials that can be helpful for other contexts whenever there is a new need or there is an opportunity from an organization to actually tackle CPP. We also launched some work on bite-sized content development for those initiatives that have been implemented and to provide and promote the work that has been done and the success that and lessons learned that we can provide to any other CPP practitioners. We are also connecting practitioners together to share on their experience and case studies. We've had the chance to have, for instance, Hamap and Colonel Maki, who did to us a first presentation, and we will have Colonel Maki later on also providing you with this information. We are launching also a series of technical workshops. So Colin was mentioning about the fact that there are lots of, we do not have guidance, we do not have standards. So we're trying to launch those technical workshops and exploring how we can harmonize CPP messaging using comparative analysis of what is already existing. We also want to tackle some more thematic workshop through, for instance, trauma-informed CPP, which is quite important in a context of conflict, but also child-centered CPP, because at this stage we're a lot talking to adults, but not. We might have some child-friendly CPP interventions, but not child-centered. So these are things that we want really to have tackled throughout this subtask team. So I wanted to showcase as well on some example. In the recent years, there have been some good case studies of harmonizing and coordinating CPP interventions and harmonizing CPP messaging like in Ukraine and in Gaza. And I'm not sure So first, I wanted to mention about the example of Ukraine. So in October 2023, you have different organizations, different partners who worked on the standardization and harmonization of CPP messages. You had HI, NPA, and UDA. It came from the idea that all partners were using different variations of an NPA PowerPoint that had been disseminated, but then each of the organization had developed their own sets of messages and implementing it in their own ways. And there were inconsistency, and it was raising concerns. So what they did is that they identified that there was a need. They gathered in a technical workshop with only the CPP implementers, those who are actually working with people who are affected by conflict and delivering the CPP sessions. And so everyone were sharing their internal data on casualty incidents or the findings from the CAP and conducted review message by message. And this is something that is might seem a bit redundant or time-consuming, but this is very effective in the way that we are working. And so they identified points of contention and verified messages accuracy, and they were able to develop a set of harmonized CPP messages for Ukraine. 2 years later, there will be a need, the same message are still applied, but they might be requiring a review to ensure that it's still consistent with the evolution of the context. Another example is related to Gaza. So in Gaza, between December 2023 and August 2024, under the Gaza Mine Action EORE, and then under the Gaza EORE and CPP Technical Working Group, a lot of work has been done in harmonizing and phasing messages according to how the conflict would evolve. So it was an initial work among within the Mine Action EORE for that, using data analysis, evidence, and social media and field observation and behavioral projection. But then, starting from that, the different stakeholders within the Mine Action EORs starting to integrate other sectors like MHPSS to ensure that there would be MHPSS trauma sensitive, And later on, so since the first draft, there has been a second draft of this, and it became a dynamic document that is still being used by all the actors and that everyone can use as much as they need whenever they're delivering CPP activities and according to how the conflict is evolving. Now, from these example, few lessons learned. We've identified, and Colonel Maki will talk more about this, but that if it's not supported, if harmonization and coordination is not supported by national authorities, it takes time. Colleen was mentioning that we are most of the time very slow in the CPP interventions. And it might take multiple workshops, multiple discussions to go through that. And especially if we're not starting from scratch altogether on the harmonization, because then we need to use the different versions that each actors are actually using. But having harmonized messages doesn't necessarily mean that each organization have to use the exact same message. We have to respect that each organization have their own mandate. It can just be a reference menu of accurate and technically sound and tested messages. Also, and I think it's still important to remind that having harmonized messages doesn't mean one size fits all. We cannot, for instance, with the messages in Ukraine, use the message for evacuation from your own home to population that are already displaced. These are kind of things that we still see sometimes, and I think it's very important that we adapt to the population we're targeting through the messages. Thank you. And finally, some main recommendations that I thought were important to highlight as a conclusion to what I'm saying. It's important, the coordination and harmonization of CPP messaging are essential in delivering CPP, in developing and delivering CPP. But for that, you need to have a constant monitoring of how the conflict evolves and the means of the armed violence. In some contexts, it might be evolving from ground incursion towards more bombing and shelling and or the use of drones. But establishing this harmonized CPP messaging and having this coordination mechanism, it reduces duplication. It ensures consistency and consistent messaging. It builds trust as well among operators. In some contexts, you do not have trust among operators due to the sensitivity of the conflict. It reinforces complementary messaging. Each actor can bring different technicity. And I will try to stop there. I had more, but I know that I have to stop. But up until now, I've been talking about coordination and harmonization. But these are just an initial, although iterative step, but it's just the beginning, because then you have to implement. And then you have to design the materials and trainings and actually deliver those messaging or those materials to the population that we're targeting. And I think Mohamed is going to be talking about this.
Perfect. This is very interesting. Thank you very much, Marie. And indeed, it takes time. So now we move on to a more grounded view of implementing CPP in one of the most protracted and volatile contexts. So joining us online from Gaza, Palestine, we have Mohammed Saleh. Mohammed, thank you very much for being with us. Can you hear us, Mohammed?
Yes, Lubna, thank you. Thank you so much.
Thank you very much.
So can you hear me?
I just have a couple of questions for you. I want to ask you your insights about integrating CPP and EORE in Gaza. How was it coordinated? How did you do cross-sectoral approaches? And in such a constrained environment, how did you overcome the challenges and made sure that messaging reached the people that most need it? So over to you, Mohammed. And we can see your screen and presentation.
Thank you for the presentation. Good afternoon, everyone. Firstly, I would like to thank you.
Mohammed, can you raise your voice a little bit? We can
now
hear you.
Is it better now?
Yes.
Okay. So firstly, I would like to thank you for your interest in such an event, also for the organizer of the event. To our colleagues in the field around the world, serving the affected communities in such as they can despite the difficulties. Also, I would like to thank Marie to mention the importance of the coordination and harmonization. So regarding your questions, Lubna, in Palestine, Gaza, before the 7th of October, the CPP messages in Gaza were primarily focused on specific area, which known on conflict escalations, such as eastern part of Khan Yunis and Gaza City. However, the scale of the recent conflict was matchless, affecting the entire of Gaza Strip, which include the area previously considered as a safe area and more stable area. This sudden expansion of the conflict meant that pre-existing CPP materials and strategies were no longer adequate or relevant. We had to adapt our messages and to include them to explosive weapons and explosive ordnance, and to highlight the currently used during the ongoing conflict. At first, we relied on our previous experience in the context and on a lot of open source reports that we try to verify with colleagues here in the field. So I try to identify the types of contamination and the scale of it. And we adapted our materials quickly based on that until we could have our EOD team's colleagues verify it on the ground. Unfortunate evacuation orders also change, moving the localized instructions to evacuate the specific streets or houses or streets, to evacuate entire blocks in Gaza, and even sometimes governorates. This requires a complete overhaul of CPP messaging and reflect the new widespread national and the sensitivity of the conflict. In Palestine, we are co-leading the mine action. HI is co-leading the mine action area for responsibility. We try to support the efforts by coordination and doing the priority of mine action activities to save more lives and to facilitate the safe delivery of life-saving assistance by other humanitarian actors. Actors active in providing protection or watch or food or health programs, and even sometimes with early recovery activities. HI is actively participating in with other actors in the field. We are working closely with UNMAS, NBA, UNICEF, MAG, and other partners through the mine action area of responsibility, which has the Explosive Risk Education Technical Working Group, the UD, and the VA groups in Gaza. At the beginning, the partners agreed in developing an effective strategy for risk education, as mentioned by colleagues. As part of Gaza response, it's crucial to recognize the dynamic nature of the context. The fundamental principle guiding this methodology is the need of the phase messages according to involving context. This approach is necessarily dedicated to ever-changing landscape of the ongoing conflict. We try to understand the diverse nature of risk and risk-taking behavior to be associated with explosive ordnance and explosive weapons and with the wide area affected. Many topics were highlighted and discussed urgently in response to the high needs in Gaza. HI and UNMAS activated quickly the safety briefing sessions for humanitarians. However, both engaged in enhancing the used training material based on the collected feedback from the field. HI worked also with the technical working group, the Risk Education CBB technical working group, to standardize the used material and even to standardize some other activities like the mass media campaigns, such as using of SMS and radio spots. And we worked on the standardizing of the IEC materials to be used on the direct awareness sessions by other actors. Those messages and materials were developed and reviewed by both communities and other members under the Risk Education CBB Technical Working Group. In the mid of the last year, the Mine Action Area Flexibility and all other mine action organizations reviewed and adapted the set of CBB messages according to phase scenario, especially during the ongoing hostilities and post-ceasefire. We adapted and social and behavior change communication approach to identify priority risk-taking behavior, to define a set of messages based on the different situation people could face after shelling or under the rubble, during a crossfire, during displacement, or when encountering an explosive ordnance, if they are reach a contaminated area. HI was very active in the cross-sector collaboration by engaging with the protection cluster, the Mine Action Area for Responsibility, OCHA, and other organizations operates within other sectors like food security, watch, shelter, and health. In partnership with the Mine Action Area for Responsibility and Risk Education CBB Technical Working Group, fellow the mine action actors, HI advocated for the mainstreaming of explosive ordnance risk education and conflict preparedness and protection across sectorial intervention. For instance, this included integrating the CBB messages into food and NFI kit distributions, as well as offering safety briefings for the frontliner worker and first responders. by clearly demonstrating how risk education and CBB contributes to the success of other sectoral objectives, such as facilitating safe access to the water points or enabling the establishment of IDP camps, which effectively build bridges across the intervention and created opportunities to joint action. To support this integrated approach, HI is participating and also actively in multi-sectorial assessment conducted by the clusters to identify gaps and to report those gaps to the technical working group to work on it with the other team members. And also, we inform the program internally and externally, and we continue the coordination to response efforts. HI also facilitated weekly coordination meeting internally and participating externally with the relevant clusters to review the individual cases, align activities, and ensure the synergy across the intervention. In addition, HI maintained a strong referral system, both referring beneficiaries to essential services such as the education in emergency, psychosocial support, child-friendly spaces, both assistance, shelter, and rehabilitation, and receiving referrals from those same sectors to provide mine action support. This approach ensured that individuals and communities received a comprehensive needs-based support. Well, in the integration, one of the examples of the integration between the sectors, the key challenges. We try to build based on our experience, to try to integrate with the CBB and risk education with MHPSS. We success to engage the social worker as risk education CBB facilitators. The integration of the psychologists alongside risk education teams was an innovation approach to allowing for integrated MHPSS services and awareness messages. HI recognized the crucial need for MHPSS services in Gaza due to the current situation and the need and the affected by trauma at the country level. HI integrated MHPSS and with risk education, viewing the presence the psychologist alongside with the risk education team as a significant bonus. Risk education teams were composed of social workers. With the social workers, the social workers played a virtual role, delivering risk education session, CBB session, key messages to their interactions with the beneficiaries and facilitating connections with psychologists for those needs for extra support, either individual or through group sessions. Furthermore, the risk education team members received the training and BFA, enabling them to refer initial support and identify individuals require more specialized assistance. This integration of MHPSS also helped to identify individuals who are in need for other services, such as non-food items, some cases and need advanced MHPSS services. Also, some cases need for GBV services and child protection services. On a weekly basis, and during our internal coordination meeting, we try to help to discuss the cases and to ensure the synergy between the different layers of HI approach. The beneficiary in need of other services like education and emergency or recreation activities were referred to other relevant organizations, and referrals also were received from other organizations. Ensuring the comprehensive approach, importantly, the psychological support was also provided to the team members themselves through hotlines, external psychologists, and individual group sessions, recognizing the impact of the conflict on their well-being and ensured their ability to continue providing services when possible, of course. HI Risk Education CBB team trained on PFA and also trained on GBV, especially on the identification of cases, focusing on how to identify cases and refer the cases from the field. HI team, the risk education CBB teams become, in a way, cross-sector, multitask team by integrating other roles and responsibility, typically from others.
Mohammed, just to mention that you have 1 minute, so if you could please wrap up. Thank you.
Sure. Quickly. So also about the materials, we worked together with the Risk Education Technical Working Group and the active members to, and also in the field to collect the feedback on the currently used materials, and we adapted the materials accordingly. And harmonization, under the harmonization also, HI trained before the conflict over than 300 community focal points as emergency team, and this allows us to continue to start the intervention during the to respond to the needs quickly. And of course, they received refresher training during the conflict to reflect what was adapted. So some challenges. The key challenges including, the combating the humanitarian priorities at early stages of the conflict. As you see, we try to mainstream the risk education messages with other sectors. Reaching the vulnerable people was also challenging, managing staff displacement and trauma, difficulties in getting materials into Gaza. It was examples. I will not go more in details. I will let my colleague, Colin, to speak more about the challenges, and back to you, Lubna. Thank you.
Thank you very much, Mohammed, for shedding light on the situation and on the work and the challenges that is done in a context with renewed military operations. So, Colin, I'll come back to you in your capacity as co-chair of the EORE CPP Technical Working Group for Gaza. And I want to ask you, how have you been helping different partners to overcome the challenges that they faced over the past year? And if we're speaking about the situation in Gaza, what is the current focus of the technical working group?
Yeah, thanks. And first off, I want to commend HI for their amazing work delivering EORE and CPP under extremely difficult circumstances in Gaza over the last year and a half. And they've been very effective at implementing EORE and especially CPP via many different vectors, whether that's training, radio, social media, or SMS. They're trying under very difficult circumstances to get messaging out to those who need them, those messages when they need them most. So HI is one of 23 members, sitting members on the Gaza EORE CPP Technical Working Group, which was set up by the newly established Gaza Mine Action EORE in the immediate outset of the ongoing conflict in Gaza. Because this has been a prolonged conflict, which has been heavily characterized by the use of explosive weapons in populated areas, it was extremely important from the get-go that CPP be a critical component of the coordinated response to promote safe behaviors and help mitigate the impact of a WIPA, in addition to addressing the risks posed by widespread ERW contamination through EORE. The overall objective of the Gaza EORE CPP Technical Working Group is to provide guidance to the sector and identify and improve ways for integration, better effectiveness, efficiency, and the relevance of risk education approaches in Gaza and beyond. Practically speaking, what does this mean? What have we been doing to support partners? Mohammed noted a few things, but practically speaking, we've been holding regular meetings for the EORE CPP practitioners to coordinate activities, to share information, to prioritize joint actions. We've been producing and disseminating standardized phase-based EORE and CPP safety messaging, both in English and Arabic, so that safety messaging for CPP and EORE is streamlined and that materials fall in line with those standards. We've been developing and implementing a humanitarian to humanitarian EORE CPP training package in both English and Arabic to facilitate training for humanitarian workers operating inside Gaza. We've been producing and sharing EORE and CPP materials for use by partners and providing guidance on materials design when partners are developing their own. And very critically, we've been tracking partner EORE CPP operations and media outreach through a variety of information management tools so that we have a coordinated approach and we're avoiding duplication of effort. Gaza was really the first context in which CPP was implemented. It was introduced in 2015 as a pilot and grew from there. It's been implemented ever since. So we were somewhat lucky that at the outset of this conflict, but up until that point, NPA, UNMAS, and local NGOs like MAN, the Palestinian Organization for Development, POD, Save Youth Future Society, SYFS, and Palestinian Save the Children Foundation, PSCF, all had been implementing CPP up until that point. So we did have quite a large body of messages and materials and capacity on the ground when this conflict broke out. However, that all became disrupted because of the scale and size and severity of the conflict. But I'm happy to say that the establishment of this EORE CPP Technical Working Group for Gaza has now enabled 13 organizations to be currently conducting CPP across Gaza and integrating it with their risk education approaches. The biggest challenge, as Mohammed noted, is adapting messages that had existed and had been working within that context when it was a prolonged conflict from 2015 or following the 2014 war up until the outbreak of the current conflict. But with massive displacement and the severe lack of safe shelter for people, those messages had to be adapted and changed along with EORE messages as well. So this, by forming the TWG, we were able to create a forum in which to facilitate that and support partners. This model is now being replicated for the West Bank, or has been replicated, so there is a technical working group for EORE and CPP in the West Bank, which is extremely important now that the situation is very rapidly escalating in the West Bank and violence is getting worse. And so overall, I believe that the Gaza EORE CPP Technical Working Group has been a good model for mainstreaming CPP, establishing standardized and harmonized messaging, supporting partners, and I would strongly encourage any other mine action AOR that exists within an active emergency environment to kind of follow in the same steps and implement this yourself. Thanks.
Thank you very much, Colin. And Hugo, I'll move now to you. You can let us know a bit about tools and approaches that have been proven useful in fostering collaboration across organizations. As we know, innovation in emergencies is not easy, but it's essential and it's important. So can you tell us a little bit about LAHA platform and how it integrated CPP and how it's contributing to reach people with timely and protective messaging? Over to you.
Thanks so much, Lubna and Mathieu, for organizing this event on behalf of the EORE Advisory Group. It's good to see the vitality of this group as we see in this room, the diversity of colleagues who are allies of the EORE cause and the CPP cause as well. So it's really great to see you, to have such a great panel with me and all colleagues online, even colleagues from the field in Lebanon or Gaza. It's really amazing. So I want to thank you all on that. I will start with an analysis that we just released. It's not yet published. It's not yet available online, but I want to highlight a few things here. This is data about children killed and maimed in armed conflict, in 26 situations of conflict across the world. And it's an analysis spanning across the last years, especially the last 5 years. And what you see here is verified data, UN verified data. Each case has been verified as a case that really happened with primary source, with triangulation, etc. So this is very robust data that the Secretary General is reporting back to the Security Council on a yearly basis. So this is a very important agenda for the UN. It's called the CAC agenda, Children and Armed Conflict Agenda, and we'll have a session on that on Friday in one of the plenaries. What you see here is a trend where you can see that explosive weapons account for 58% of killing and maiming of children in armed conflict. That's the trend, and that's the data for 2023. So it's increasing year by year. Explosive weapons, especially explosive weapons in populated areas, are becoming the first threat for children in those conflict situations. And if we look at the data on the absolute figure here, more than 25,000 children have been documented, have been verified as killed and maimed by these devices, out of which around 7,500 were killed and maimed by explosive ordnance. In this case, I mean landmines and ERW. So we are well equipped to prevent those grave violations through, for example, EORE. EORE is a key activity to prevent accident of landmines and ERW, but also any mine action activity can contribute to prevent those grave violations. But these grave violations account for 30% of this universe of children, of 25,000 children killed and maimed by explosive weapons, meaning that for 70% of those children killed and maimed by explosive weapons, it's about the active use of weapons. So that's why we need CPP to prevent those accidents, to help support, prevent those grave violations. So one key message here is that the caseload is massive, and to address this caseload, not only we need CPP, but we alone cannot address this as a sector, even as a mine action sector. So we need to collaborate with other sectors. We need to break down the silos, as Anna mentioned, and I will give you an example of breaking down the silos with the GBV sector. And more particularly, I will highlight a tool here, an approach, a platform that was developed recently. It's called the LAHA platform. So first, a couple of words about GBV, gender-based violence. It's, of course, a pandemic. It's happening in every place in the world, even in this country where we are now. It's happening everywhere. To give you an idea, every day, 137 women are being killed by one member of their family. That is the trend. It's an average. It's happening on a daily level. 137 women killed. There are other issues. Technology-facilitated gender-based violence is becoming more and more prevalent. Globally, 38% of women have suffered from some type of online abuse. Recently in Sudan, one of the most EO-affected country in the world, EWIPA-affected country, we have realized that the feminicide have doubled in 1 year. And the main reason for that is because women have more access to mobile phone. And there is a perception in Sudan that that when women spend time on their mobile phone, it may be because they are engaging online with males, with men. And because of this perception, the gender-based violence doubled in 1 year. So this is an example of online and offline cycle of abuse. And for women and girls, there are so many barriers. Access to mobile phone, access to services linked to gender-based violence, all these services are a challenge for them. And that's why we thought we need to develop a platform to support women and girls across the world. And that's how LAHA became a reality and was piloted. But the main thing here to highlight is that it was not developed by us, but developed primarily by women and girls themselves. So there was a whole consultation process. More than 500 girls and women were consulted to develop this platform, this online platform. And I will give a couple of examples in a minute. And don't worry, I have some videos that I will not play today. I have only 5 minutes to brief you on that, but you will get the package with the whole slides, and you will have access to all those videos. The platform here this highlights how this platform works. Actually, it's not an app, it's a website, and women and girls have access to this website through YouTube or through Google. They have access to this website, and it was their choice. An app is not safe for women and girls, especially on gender-based violence. It's not safe for them, while a website is much more safe. That's why we created this exit website button. So when a woman feels unsafe, when she's consulting this website, she can press this button and it will bring her to the Google web page immediately. So that's one of the reasons why we needed to consult those women and girls to make sure it is completely safe for them, that it doesn't exacerbate their vulnerability. There are chatbots. Now they are developing IVR, interactive voice response, to make sure that it can be used also offline without internet connection. So this platform provides so many services, and it's across 139 modules. And what we did together with this group, in consultation with women and girls, we developed a series of modules on CPP in particular, and on EORE as well. So these modules are now active. They are part of this menu of modules, because it matters for so many women and girls across armed conflict. It matters for them to know how to protect themselves, how to protect their sisters, how to protect their children on this type of risk. So this was integrated. It's now piloted, and you see where this platform is now available in various languages. I won't list all the countries, but it's now available, of course, in Palestine, and so many other contexts, and being developed in Syria, Yemen, Sudan, and other contexts. So women, young adolescents have access to all those services, including CPP, EORE, as I mentioned. What I forgot to mention is that when I was talking about GBV, actually, in a conflict setting, GBV is very much exacerbated. There are many more cases in conflict setting or in any humanitarian crisis. It can be 20 times higher. The prevalence of GBV can be 20 times higher, exactly as we see these days in DRC, where GBV is the most prominent violation, even if we also have an issue with EWIPA and explosive ordnance. So it makes sense for those women and girls to have these menu of services where they can shift from one menu to the other, and when they also can get access to services. What I didn't mention is that for each country, there's a menu of services that is updated on a regular basis. So they know which number they can call, they know which service they are entitled for, they can benefit from. And I think that's it, yes. So just a quick introduction of this platform. You have the expert on this, her name is here. She could not make it today, so I was presenting on her behalf. She's the mother of this platform and would be at your disposal to provide you any update on this LAHA platform as an example of integration of CPP in a much broader sector. Thank you.
Thank you very much, Oog. And for our last segment, we are going to dedicate the spotlight to national ownership. So now we will go to Lebanon as the first example of a national mine action authority taking the lead in CPP with impressive results. So joining us online from ALMAC, Lieutenant Colonel Ali Makki, thank you for being with us. And can you please share with us what encouraged ALMAC to take ownership of CPP integration, and what were the enabling factors that allowed ALMAC to champion CPP so effectively? So over to you.
Thank you, Lubna. Good afternoon, everyone. My name is Lieutenant Colonel Ali Makki. I am the head of Explosive Ordnance Risk Education and Media Section Head at Lebanon Mine Action Center. So it's my honor, first of all, to be with you remotely from Lebanon for such important side event. I want to share my screen to speak a little bit about a very important subject, and it was a very important intervention and initiative that taken into consideration in Lebanon during the last war. So I will present now my screen, share my screen now. Just confirm me if everything going well.
Yes, we see your screen.
That okay? I want to inform you that announce that Lebanon taken this initiative for many reasons. In my short presentation, I want to give time for questions, but I will present a short, just a few slides about our sequence of work and how it going during the progress of the conflict and the impact. This is, as I mentioned, this is a very important subject, and it's urgent to protect civilians in active conflict through our involving conflict preparedness and the protection CPP strategy in Lebanon. As many of you know, that Lebanon faced numerous challenges due to ongoing regional instability. The war of 2023 and 2024 have only heightened this risk, and it became clear that traditional methods of risk education were no longer enough. Today, I will walk you through how Lebanon is incorporating CPP into its mine action framework, a timely and necessary adaptation in response to current conflict conditions. Why CPP and why now? Traditionally, our focus was explosive ordnance risk education, a standard tool to help communities identify and avoid the dangers of unexploded ordnance and landmine. However, in light of this escalation in conflict, particularly after September 2024, our communities faced an even broader set of risks. We saw a major influx of internally displaced persons and a sharp increase in emergency need, food, shelters, and above all, protection. It was clear our response had to go beyond EORE. So this is where CPP came in, not a replacement, but as a complementary and urgent tool for holistic community protection. How did we implement the CPP? We began with a rapid assessment in collaboration with our partners in the humanitarian mine action sector through a technical working group that led and chaired by ELMAC. Based on their input and the ground realities, the Lebanon Mine Action Center made the strategic decision to shift in phases from EORE to CPP in areas most affected by the conflict. We quickly adapted. We trained our community liaison officer and EORE activists conducted sessions at the Regional School for Humanitarian Demining in Lebanon and aligned our strategy with local needs, always under the supervision of and approval of Lebanon Mine Action Center. We also ensured no duplication of effort by carefully assigning operational area of operation among active sectors. So now I will go through our current situation and progress, and I want to mention here that our experience and sequence of progress and adaptation for the situation was very, very efficient, and we was adaptive to, and low. We didn't lose resources in personnel and in fund. We adapt directly our teams to be multitask to deliver the CPP message in parallel with the EORE message, and later on, in some places, we just deliver the CPP messages. I want to go now to explain our current situation with a ceasefire now as announced. We have begun integrating the CPP content into our regular EORE session because, as you know, that there is the 3 phases of CPP. The last phases is after conflict, and there is some places where we are now during the conflict, and it means the second phase. So the CPP now is implemented into the EORE session as well. We have expanded outreach via billboards, TV, and radio messaging and social media, which has proven highly effectiveness in Lebanon. And I want to mention here that the result of all this effort during the almost 1 year and a half is increasing the number of, decreasing the number of victims by 97%. In comparing with the conflict of 2006, we had 220 victims after 2 months, just after 2 months of announcement of ceasefire at that time. But now we have just 7 victims, unfortunately for sure, but just 7 victims after the ceasefire for more than 3 months. So we decreased the number of victims by 97%. And this happened because it was the campaigns was well managed, and the partnership and of the implemented agencies and the coordination between them and with us as national authority was in the best process. This blended approach has allowed us to respond to both immediate dangers and long-term risks, increase both community awareness awareness and resilience. But for sure, there is a lot of lesson learned. A few key lessons that I want to share with you. The strong leadership of a national authority like ELMAC is vital for harmonizing efforts. And this is what I was mentioned in a few seconds before. And the CPP must be adapted and adopted for each country's context and sensitivity. The resistance to change is everywhere, I think, and the limited resources are challenges as well. But those are not an obstacles. We can go through those challenges and try to solve each problem by side. And most importantly, this integrated approach has already begun to show long-term benefit for at-risk committee. And we had a lot of success story for that, and real story about what happened after the committee has had the chance to get those type of information. So we are now entering a new chapter in risk education. The CPP has proven itself as more than just a temporary solution. It's life-saving. It's a protection-driven approach that empowers committee to face not only explosive threats, but broader conflict and environmental risk as well, maybe. So we ask, there is point for discussion. That I want to raise my voice in front of all of you to try to find some standard and some knowledge about it. How we can give CPP more visibility and legacy on the international level. And this, I think, this side event is part of this activity that we want to go through. And as more and more, and as our colleague Marie also she mentioned that there is a workshop that for 2 days that will highlight the importance of CPP in this sector. What tools and practices best integrate CPP with existing mine action strategies? Can we make CPP essential in all emergency contexts? And this is what mentioned Colin. Thank you, Colin, for mentioning that it's not just conflict, but also earthquake or natural disaster. And finally, do we create a quality assurance system for CPP going forward? So this is important because we adopt the CPP without knowing any previous information and the standard. It was like adventure in some places, but the life will not, and the situation will not stop under to take to put a strategy and standard and a lot of assessment and studies, because we should save lives as much as quick as we can, and especially for after the big escalation that happened in last September and in Lebanon. So I want here in closing to tell that the integration of CPP into our work is not just a technical evolution, but it's a moral one. It's about giving our committee the tool to survive, adapt, and thrive, even in the most dangerous of time. And I want to tell thank you for everyone who helped us in Lebanon, and especially the national and international agencies that they put themselves into danger in some places, into danger to deliver and disseminate those important messages that the people need to listen and to for a safe behavior, to behave as in a safe manner. So thank you, and the floor is yours, Lubna.
Thank you very much, Lieutenant Ali Makki, for showing us an example of what happens when a national authority takes ownership of CPP, when communities are prepared and messages are harmonized. So thank you very much. I'd like to remind you that we have copies outside for Gaza and Ukraine messages if you want to take a look. And now I'm going to open the floor for questions, so please raise your hands. Yes, please. Yes.
It's not a question, it's just a comment. I'm currently heading a national organization in Lebanon, and I wanted to highlight it was a very difficult time, extremely difficult, and I just, because we talk about MPHSS, and during the crisis, when the war expanded, we had a very solid community working group that discussed, for example, if we go to shelters and people don't have food, don't have shelters, do we sit around and talk about EORE? No, we cannot, because they have priority for food. So we started giving flyers, right? So it was very dynamic, and through this we helped support in every phase. We gave the right amount, and we distributed flyers all over, and that's what they contributed to the decrease in comparative decrease in, although this is programmatic, we cannot consider them as beneficiaries, right? But these are very important. In terms of CPP, also another aspect of mental health. So we had, we're distributing flyers, and Lebanon was partly safe and partly unsafe. And these people moved to shelters. So the question was regarding CPP and the challenges of CPP. Do we teach the other population that is in safe place about CPP, or are we contributing to another additional panic to the whole population, which already we cannot absorb the panic of the people in the conflict zone? And this is the resistance he spoke about, although CPP can be very common sense and is not necessarily something dramatic and crisis. So this is, I think, to improve something, and it's already great. We have to know what are the challenges and what are the perception of people for the resistance to change. Lastly, I would like to say that my daughter was in the school, and just the importance of CPP, and there was attacks, and she panicked, and the teacher couldn't do something. She still says they gave her a mint because they didn't know what to do. And I think it's a form of distraction, so it's under CPP, but definitely the need for more teachers, everybody that deals with kids to know how to be prepared, not only with, practical, but also mentally, and how to, talk to children, which is part of CPP. And I want to thank, lastly, HI and HAMAP for supporting all the national organization on CPP and EORE and training us for this. Thank you.
Thank you very much for your intervention and for sharing a personal example. So do we have any questions? Yes, please.
Thank you very much, all speakers, for the wonderful lecture. I appreciate all of you. There are, of course, the differences in so many countries and in so many situations. For me, being a doctor, I would employ my situation as a double cancer, because you have maybe one cancer, you treat with chemotherapy, and then you have developed another cancer called lymphoma. So my point is, okay, we want to save life, we want to give people education. It's not that is enough, we have to go to action. Okay, that's agreed on. But the fact that in such a scenario, all team members must coordinate and cooperate. But if some of them do not, for instance, those under the influence of narcotics or any of that sort, it is very difficult because they will not comply. And they will do, even in those areas where it is contested, not only specific to the mine injury, other types of things may happen to anybody. So safety of your staff, your volunteers, is your responsibility too. So in that context, I want your expert opinion on how should I go about in such, as I say, double cancer circumstances.
Maybe I'll just quickly chime in. I think there's a lot to unpack there, but I very much understand what you're saying, and certainly in Myanmar, it's a very difficult situation. According to ACLED, it's the third most intense armed conflict that is taking place in the world right now, and one that is extremely dynamic, involving widespread use of explosive weapons in every single kind of form, and many different fighting groups. The CPP approach, I think the strength of it is that, at least when it comes to risk education, is that we're trying to empower civilians, give them the knowledge that they need in order to be better prepared and to take preemptive action in order to better protect themselves. So the focus is trying to impart that knowledge as effectively as possible in a way that's retained and actioned by communities. And of course, the kind of absorption rate is not going to be 100%. Like you said, some communities may be more resistant, or some groups may be more resistant or unable for whatever reason to action it. But at the end of the day, we can't physically stand between civilians and projectiles and rockets and airdrop bombs. It's not possible for us to physically protect them. But CPP, what it does is empowers these civilians in order to take action themselves to better protect themselves. And I think that's the strength of the approach. Whether it can be 100% communicated to all people, very difficult. That goes for normal, traditional EORE as well. But that's kind of the challenge.
Okay, thank you very much. And just some concluding remarks for the sake of time. So we mentioned the importance of coordinated and harmonized messaging in saving lives, reducing confusion, and increasing trust. We also spoke about that there's a clear need to formalize CPP within global mine action and humanitarian frameworks. We also spoke about the importance of breaking silos, working together for collective learning and collective growth, and the importance of national ownership when we speak about CPP and integration in EORE. So thank you very much, everyone. Thank you to the GICHD and the EORE advisory group. And thank you to our panelists for making this event happen, joining us in the room and online. And hope you enjoy the other plenaries and events of the NDM. Thank you, everyone.